The Delmar Divide is literally a street that cuts the city in half. On the north side of Delmar are predominantly black neighborhoods, and on the south side are predominantly white neighborhoods.
The shops on the left and the right, the eclectic nature, the barbecue smells, the blues and jazz is amazing. And then all of a sudden it comes to an abrupt stop. And there's invisible things that manifested that made that happen. St. Louis really was founded on medical care and medical institutions and high academic quality.
There were 2 public hospitals. Homer G. Phillips served Black community members, and for the 40-plus years that it was in operation, it was training a third of the nation's Black doctors. Really, for one of the first times, you had community members who were seeing doctors that lived in their community. Mid-1970s, the city government was like, we have to close one of these hospitals because we don't have the funding to be able to support them. Homer G was doing a lot more with a lot less funding. And St. Louis decided, no, we're gonna close Homer G down. And they essentially did so in the middle of the night. There were all sorts of protests around it. Really, this pride and joy was gone. It created this sense of healthcare isn't for me in our largely Black communities.
I think that the most striking and often deeply rooted mistrust is among communities that have been harmed by the healthcare system historically and even contemporarily. Black and Latina women at various points in U.S. history in various states were literally sterilized without their permission, right? Government programs were intended to stop particular populations of women from being able to have any more children. And that's just one example. But it's also worth noting that mistrust isn't something that just stems from history. Ultimately, trust is also structural. Trust is built. Trust is earned over time in many communities. That just hasn't happened.
We're getting a chance to say, let's look upstream and let's think about young people who perhaps haven't been taught those values and those behaviors that we know actually harm patients. We began to attract these young leaders, expose them to community environments, undo some of the medical history and trauma and learning so that they could redo it in a way that was just and fair and centered the patient.
We're having really frank and honest conversations about racism, trauma-informed care, that kind of thing. There's not a lot of places where that conversation is happening. Let's undo some of the stuff that you think it means to be a medical doctor, and let's re-socialize you into this way of thinking about healthcare as something that should be done equitably, something that requires an anti-racism lens. It's about mindfulness in your approach to patients and making sure that you're doing it every time and not just sort of going through your checklist. I think that's how the system starts to shift, is asking questions and really pushing, like, does it have to be this way, or is it just this way because that's how it's always been?
As a medical student, it's easy to get lost into the, these are the illnesses, these are the symptoms I look for, and if they have these symptoms, then I prescribe them X, and bringing it back to your patients and what do their lives look like is something that can get lost easily when we're being sprayed with the fire hose that is medical school.
All right, so what's been going on?
Right now I'm just having that pain on this side, but sometimes it's on this side, but it goes towards my back.
As a future physician, what advice would you give me?
listen to the people. Don't get me wrong, you get rude doctors. They think they know exactly what's wrong with you. And you try to explain this to them, but they are not listening to how you feeling. When you listen to people listen back sometimes. And they'll do what you ask them to do just as long as you keep listening. Not just assume that I'm gonna feel better just because you said so. Or this is how it's supposed to go. But sometimes you just gotta slow down. It'll be all right. It ain't gonna kill you for, just to sit down and listen to them.
If you use universal precautions and just assume that everyone has experienced some sort of trauma in their life, you're going to want to acknowledge that that trauma may be rooted in cultural practice, that they have experienced some discrimination around something physical, something mental. And how would you treat a patient knowing that maybe they've experienced that? How would you give them choice? What would safety look like in that situation? And that's ultimately what we're trying to build out, is this sort of compassion for our patients.
What do we get at the end of all of these changes towards inclusivity, towards equity? I always think we end up with what each of us want for ourselves and for the people that we love, but everybody gets it. We all want dignity. We all want justice. We all want love. We need to leave space in the process for the voices of the people most affected, who are going to have to live with the consequences of these policies. And unless we start crafting some of these new pathways in our politics, in our society, towards everyone having access to the resources that they need for health, we will never be able to get to these bigger, bolder ends. Institutions are operating on the ground in material ways that are inequitable. When I go to the neighborhood I grew up in Queens, and I look at the clinics there and I look at the hospitals there, and then I go to a predominantly white or wealthier community, who is invested in and taken care of is clear. And that is informing my trust. You can tell me all men were created equal. Okay, but that's not what I see. That's not what I've ever seen. So why should I believe you?
The opportunity to broker and bridge trust between community and healthcare will look like a lot of leaders in power stepping back, changing their position, opening doors for other leaders to come through, seeding money and training, because we have to reverse 200 years worth of a path that we had chosen to take. Closing the gap of inequities and sickness will remind people who have been told that they don't matter and that they're invisible. It will communicate that your health matters, that you're valuable, and that you are fully human. The systems and the structures, the policies that are in place, they were intentional by design. They are doing what they're supposed to be doing. And that level of truth is part of what we need to confront. There's a choice to lean into power and to accept it for what it is and to accelerate change. Be a reconciler because you are gifted uniquely to do it, so do it. In this region and in this nation, we're at a reckoning. So what's gonna happen next is up to us.